Pneumonia is a common infection that can affect one or both of your lungs at the same time. Your symptoms may vary depending on the type of pneumonia you have and other factors like your age, the strength of your immune system, and other underlying medical conditions you have. Here are 4 common warning signs of pneumonia. 1. You have chest pain that gets worse whenever you cough, sneeze, or take a deep breath. When you have pneumonia, smaller sacs in your lungs called alveoli become inflamed and swell. When this happens, it makes it hard for you to breathe, adding additional increased pressure and irritating your lungs and chest. Number 2. You cough up phlegm, mucus, or blood. Your alveoli will fill with fluid, pus, or mucus as a side effect of your immune system fighting off your lung infection. So it's common to cough this stuff up and even cough up a small amount of blood when you have increased inflammation in your lungs. Number 3. You have fever and/or chills. Infections and changes to your oxygen levels all have an impact on your blood pressure and the way the rest of your body functions. You may develop a fever or chills. In older adults especially, it's common. Pneumonia is an infection that inflames the air sacs in one or both lungs. The air sacs may fill with fluid or pus, purulent material, causing cough with phlegm or pus, fever, chills, and difficulty breathing. A variety of organisms, including bacteria, viruses, and fungi, can cause pneumonia. Pneumonia can range in seriousness from mild to life-threatening. It is most serious for infants and young children, people older than age 65, and people with health problems or weakened immune systems. Symptoms. The signs and symptoms of pneumonia vary from mild to severe, depending on factors such as the type of germ causing the infection and your age and overall health. Mild signs and symptoms often are similar to those of a cold or flu, but they last longer. Signs and symptoms of pneumonia may include chest pain when you breathe or cough, confusion or changes in mental awareness in adults age 65 and older, cough, which may produce phlegm, fatigue, fever, sweating and shaking, chills, lower than normal body temperature in adults older than age 65 and people with weak immune systems, nausea, vomiting or diarrhea, shortness of breath. Newborns and infants may not show any sign of the infection, or they may vomit, have a fever and cough, appear restless or tired and without energy, or have difficulty breathing and eating. When to see a doctor. See your doctor if you have difficulty breathing, chest pain, persistent fever of 102 F, 39 C, or higher, or persistent cough, especially if you're coughing up pus. It's especially important that people in these high-risk groups see a doctor. Adults older than age 65. Children younger than age 2 with signs and symptoms. People with an underlying health condition or weakened immune system. People receiving chemotherapy or taking medication that suppresses the immune system. For some older adults and people with heart failure or chronic lung problems, pneumonia can quickly become a life-threatening condition. Treatment may include antibiotics, viral or fungal medicines, controlling fever with aspirin, NSAIDs, or acetaminophen, drinking plenty of fluids, using a humidifier to help open your airways, getting lots of rest. Prevention. Vaccines can help prevent pneumonia. Good hygiene and heart-healthy living can also lower your risk. You should